everyone. Thank you for coming to our event. Our Health Technology Forum is hosted by Athenahealth. My name is Eleanor Ramachandran, and I'm part of the Health Technology Forum team. And we're going to have a very exciting panel today talking about care coordination. And let me just give you a little information about the Health Technology Forum. Founded in 2010 by Pinoy Saha, and we are a global network. And we try to bring together healthcare individuals, organizations, people, and technology people together so we can create solutions, products, services that will change people's lives, especially in the underserved and underrepresented population. We have about 14 chapters around various countries, and we do a lot of our organizations predominantly volunteer-based, and we provide a monthly events, and we recently had a conference in May in Bowling Green annual conference, bringing together a variety of healthcare providers and organizations, even technology providers, and had a very robust discussion, and topics came up that was very interesting and very promoting a lot of innovative ideas. So for today's agenda, we'd like to welcome, we'll have, is it Abe Don?
Abby.
Abby Don?
Yeah, I'm right here.
Oh, sorry. VP of UX and Strategic Design. And I think you wanted to introduce or say a few things?
Sure.
Besides items.
All right, besides being a school teacher. All right, just want to say welcome everyone. Really appreciate the opportunity to host the Health Technology Forum. I want to do a shout out to Kim Jacoby, who's an employee here. Kim, are you here? There you are, sorry. So Kim works on our medical information team. If you don't know what that is, ask her. And just a couple of quick words about Athenahealth in case you don't know. We help physicians do the right thing and get paid to do it right. We also talk about building the healthcare internet, so really trying to build the infrastructure to move lots of healthcare information around. And so to do that, we have an EHR product called Athena Clinicals. We have a billing product called Athena Collector that also helps with practice management. And then here in this office, we're really focused on all things mobile. So we're really the infrastructure for Athena's mobile health products, which some of you may know Hippocrates, which we're pretty especially well known for. Deuce Cruz tonight is going to talk about Athena Text, which is a secure text messaging product. And we're working on a mobile patient portal. So all things mobile. I will just take a moment to plug that we have 5 openings on our UX team. And so while you guys yourselves might not be UX designers, but if you are, we'd love to talk to you. But you might have networks. So if you know UX designers that are looking to do meaningful work on a very cool team, if I do say so myself, we would love to talk to you. You can go to athenahealth.com/careers. Should I introduce Lindsay? All right. Lindsay's going to talk to you a little bit about our More Disruption Please program, which we have an accelerator right here. I don't want to steal your thunder. Okay, thanks for coming.
Thanks everybody for coming out tonight. As Abby mentioned, my name is Lindsay Kempton. I help run our partnership and innovation program called More Disruption Please. We do have an accelerator space right here, which we'll be talking about a little bit later. So I think definitely wanted to show this slide as well. And I don't know if, Eleanor, if you want to speak to this or before I dive in? Okay, we'll skip it. So let me give you guys a quick overview. Abby started this great segue, so I wanted to start off just telling you a little bit about Athenahealth and who we are. We have 3 core principles here, really our vision, our mission, and our culture. So we want to build that health information backbone, that health information internet that Abby was talking about. And Abby paraphrased great our mission to be healthcare providers' most trusted service, helping them do well by doing the right thing. And our culture. We're teachers and learners, and we really believe in this vision and mission. And that's why I want to bring you guys here today. We believe in passionate groups of people that are excited about changing healthcare, and we want to get everybody together and continue that conversation. So we're really excited to have everybody here tonight. Abby also touched on our core products, so this just gives you a quick overview of Athena's business. We have over 64,000 providers on AthenaNet, so we're cloud-based, We have a great network effect, so everybody has access to the same Athenanet, which is a great differentiator for us. We have clients that range from small one-doctor practices all the way up to large health systems and moving into the inpatient space as well. So I won't bore you with all the details, but I wanted to give you just a quick overview there. So what is More Disruption Please, and how does this fit into Athena? Well, the More Disruption Please program really started about 3 years ago. And it started with our CEO, Jonathan Bush, saying, how can we change this conversation in healthcare? How can we change the culture in healthcare that's slow moving and not innovative? What can we do about that? So it started with the network, this pillar here on the left, which is really just a group of people having this conversation, what can we do about this? And it's really spawned into this great and robust partnership program. So we still have the network today, except today it's made up of over 3,000 folks like yourselves, who we bring together through events, talks like this, hackathons. We have a conference each year in the fall, essentially just to keep that conversation going and allow people to enjoy that network effect that we provide. We have our marketplace, which is a website where we display all of the best-of-breed solutions that we have partnered and integrated with. So our clients can go have a shopping-like experience, explore all the different tools that we offer integrated with Athena's products that can help them increase revenue, drive down inefficiencies, and just generally let them focus on being doctors instead of having to run this business that they really didn't want to do in the first place. Then we also have our accelerator program, which, as I mentioned, we've got a space right here. We have Anna, who's on our panel later. She's one of the CEOs of the accelerator companies. And it's a program for early stage, high potential health IT companies that we feel are really going to move the needle in the healthcare space. And so we set them up with free office space here in San Francisco, or our Boston office, or also just opened up one in Austin, Texas, which we're really excited about. And we invest in them and give them access to Athena mentors and resources. So if you want to talk to somebody on our UX team or on our product team or one of our developers to help you figure out how to improve your product, how to increase the stickiness, how to reach the docs that you're trying to reach, we want to set you up with those folks so you can take the next steps and actually scale and meet those goals. So what does this have to do with the health information backbone? Well, as part of the way that the MVP program works, we are building out APIs. So this is sort of the status quo in healthcare for a lot of places. You have point-to-point connections between an application and a doctor. It's custom built, it takes a lot of money, and takes a lot of time to build. We don't want that. We're building sort of this health information backbone that we're calling Platform as a Service through our API, and MVP is helping build that out. So the idea is that all of our partners and all of Athena's products will connect together through this sort of connectivity layer provided by the API and other sort of global integration mechanisms to create something that's really easy to integrate with and really easy to let information flow back and forth by the folks that want it and need it. Our marketplace has over 30 partners on it and 15 different capabilities. So we have everything from digital check-in. So instead of going to your doctor's office and getting that clipboard that has all of your health information on it that we've seen 1,000 times, that somebody then has to go enter into their system, you now get an iPad where you can review all your information, you can pay your balances right there, it all goes straight into Athena Clinicals. Or we have transcription solutions so that doctors can spend more time actually interacting with the patient and engaging with them rather than having to type things into the EHR. And the Accelerator is the latest addition to the program. It was launched in 2014. And so these are just a quick slide. This shows our Watertown space with our first investment over there on the right, which is Smart Scheduling. They have a great tool that essentially allows you to do intelligent double booking so that providers are no longer losing slots to no-shows and not losing that revenue. So our developer portal. This is a great way for folks to start interacting with the program. We have all of our API documentation available here. It's ready to access. All you have to do is register. You get access to all of the documentation as well as a sandbox environment so you can start to push and pull and start to integrate your tool with Athenanet today. And we're really excited about it. It's the most open API in healthcare, so we definitely encourage you to go check it out. By the numbers, we have over 850 clients using an MVP solution. And remember, a client can be a one-doc practice, or it can be a health system with over 5,000 providers. We have over 500 developers registered for the portal, and that's just going up every day, so we're really excited to see that. We're having a hackathon in Boston as well as in Austin, and hopefully in the future we're going to be having one here in San Francisco as well, so stay tuned for that. We're constantly building out new API endpoints so that eventually we can have this health information backbone, and our API calls are actually over 1 million a day at this point. So what do our partners get? Essentially, they get a go-to-market strategy in a box. We help them get access to over 64,000 providers so that they don't have to sell one doc at a time. They get connectivity. They use our API, they use our global HL7 connections, and it's free to the client, so the client no longer has to worry about spending thousands of dollars to build out an interface to connect with their tool. We help them out with joint marketing opportunities and press coverage, and we also have the ability to track their metrics. How are they performing for our providers, and give them feedback on that. And how about our clients? Well, they get 5 to 8 turnaround time, 5 to 8 days of turnaround time for their connectivity, which, as opposed to several months to actually get an interface going, is great. We test all of these interfaces. We run betas with all of our marketplace partners, so we're confident that they're stable and they're free for the client. And they don't have to spin up any teams to actually manage the onboarding or manage this partner relationship, because we help them all with that. So, sort of at the end of the day, we want you guys. This program does not succeed without our partners, without the amazing, innovative ideas that people and companies like you guys are creating. So we hope that you will engage with us, talk to us. I will be around after the panel for networking or questions. Definitely check out our website, athenahealth.com/disruption. Hopefully that's easy to remember. So you can learn a little bit more and get engaged with the program. Thank you.
We'll just start. So, Samir, if you're ready. Okay, I think we'll just, because I don't want to go back to the slide. If our panel can come up for